Hey, good morning, guys. Is it morning or is it noon? I don't know. We just got back from. Oh, it's still morning. We just we just got back from the gym, and I wanted to get on here real quick and talk a little bit about this. By the way, this is Bill with Fat Loss Made Easy. Welcome to Coach Bill's health tip for the day. Today's Monday, and I just wanted to get on here, guys, and go over something that is actually, in my opinion, and most opinion of health professionals, and I would say doctors, and also science, is the epidemic of a fatty liver disease. I really don't think people understand how serious a non-alcoholic fatty liver disease is. Now, that's what science calls it, a non-alcoholic fatty liver disease. And the reason why I just don't think enough health professionals are actually talking about this. And it's known out there as the silent killer. And why is that? Well, because most people who are overweight don't even know they have it. If you're 15, 20, 30 pounds plus overweight or obese, you have some stage of a fatty liver. And if you do not take care of this immediately and let it go on for a long period of time, the byproduct of having a fatty liver and being overweight is going to be full blown type 2 diabetes, and you do not want to go there. Okay, now, why do most people not know they have a fatty liver disease or non alcoholic fatty liver disease when they're overweight? And why aren't the doctors actually bringing this up? Because you have to do, in order to find out if you have a fatty liver, your doctor has to order you to do a ultrasound. That's the most common way to actually discover what level of fatty liver. Now, to me, any level is bad. If your liver's got a lot of fat on it, then it's going to cause issues eventually during a blood test. Now, that's how once your liver gets to a point where it's just overly fat, then it will most likely show up in your blood test as your liver markers will be a lot higher. And then they're going to want to figure out what is wrong with this, when really the answer is pretty simple. If you're overweight, you got a fatty liver. Now, what's causing this fatty liver? Well, the topic of this uh, discussion today is obesity. What does obesity and fatty liver have in common? And we already know as health professionals that obesity is actually an epidemic here in the United States. A good example, I was after church, we went to breakfast at a restaurant local here in town. And Emily and we're both health coaches, so we observe people. That's our job. And in this restaurant, we probably were sitting and waiting for a table for about 20 minutes, maybe 25 minutes. And it's really sad, guys, is that I would have to say 98% of the people that walked in and out of that restaurant, young and old, were obese. And the majority of them were grossly obese. And what does obesity and fatty liver have in common? Well, if you have fatty liver, or if you're obese, you are going to have a fatty liver. And if you were to stop these people and ask them, are they pre-diabetic or type 2 diabetic? And most of them would probably say they're either pre-diabetic or type 2. And that's all because of their fatty liver and obesity, which then will actually turn into type 2 diabetes. So I would have to say that fatty liver disease here in the United States is an epidemic. Because if obesity is, fatty liver is also. I'm also going to say, well, what's the root cause to all this? And I'm also going to have to say, mostly from foods. Obesity and fatty liver, if you look at the science, is driven by certain foods that are causing certain hormones to be out of balance. So actually, hormones is probably the driver to what's going on. It's that there's a certain hormones are out of control, causing them to keep gaining weight year after year after year, which is causing you to have a fatty liver. And also, I have to say, and research is also saying this, is that a fatty liver is also driven by how often you're eating certain foods throughout the day. That's also scientific stuff. There's all kinds of scientific studies showing this. So it's not me, guys. It's actually science that's proving it through clinical case studies and trials on obese individuals that are finding out that most likely all obesity and fatty liver and type 2 diabetes is all food driven. And the amount of foods you're eating, the certain foods you're eating per day causing you to gain so much weight, and the root cause is due to a certain hormones that are designed to store fat that are out of control, and certain hormones that are designed to create your appetite on certain foods that will cause you to get fat. And so, is there a solution to this? Absolutely. And you know, we've been teaching the solution to people for quite a few years, Emily and I. We're actually about ready to launch a new website training website that I put together. It's taken us about 8 months with a designer, and we've spent a lot of hours of publishing training books and doing videos to go along with those training books. And this website is going to give you your step-by-step roadmap on how to reverse obesity, type 2 diabetes, fatty liver, and lose belly fat and so forth. And it's very sophisticated, and you're going to get every single tool you possibly need and explanations on how to use it through this website. I have courses and packages to choose from that will fit most people's budget. But you have to look at, you know, what's your health worth? So how much are you spending on the medication for your type 2 diabetes or high blood pressure medicine because you're obese? So don't put a price on your health. You know, you can contact me at Bill Mabry, Bill at billmabrycoaching.com, and I can give you the information right now on these courses so you can actually get started before the website's launched, which should be soon. But it's really as simple. It's simple to reverse fatty liver, and it's really simple to reverse type 2 diabetes and get most of you off medication if you have the right tools, guidance, and education, and you'll see how simple it really is. And there's really, you guys might not know this, but olive oil, a good source of virgin olive oil. Not all olive oils are the same, guys. You need to find a local company that makes their own organic olive oil local and where it's not shipped. Because normally what happens, if you think you're getting a source of olive oil from out of the country, you're wrong, because it putrefies pretty quick. So you need to find a local, you know, here in Temecula, we have the Temecula Olive company here, and I think you can actually go online and order the olive oil, but that's what we use. But olive oil, combine it with molecular hydrogen H2, which is in hydrogen-rich water. Both of those, there's science research showing they're going to help reverse fatty liver disease, which is also going to help reverse what? Your high blood pressure, which is also going to help reverse what? You being overweight. And so there's actually science. Now, when you combine, or there's 3 programs that we use on our online course to reverse fatty liver disease, obesity, type 2 diabetes, or belly fat. There's three programs. The first one is a high good dietary fat, low carb meal. The second one is incorporating intermittent fasting and extended fasting. And the third one is change the type of water you're drinking to hydrogen or molecular hydrogen H2 molecules that are in hydrogen-rich water. Those 3 programs right there off the bat will reverse all 3 of these and very quickly if you're consistent. But what's really unique is virgin olive oil, if taken every day. So, for example, I've been taking virgin olive oil now for a few years, and I do 2 to 3 tablespoons per day with my meals. And now I'm on a high-fat, low-carb meal plan, and that's how I add more fat to my main meal, which is mainly my dinner meal, is I will consume a tablespoon of olive oil. And, of course, other good dietary fats like avocados or olives, or I'll add some hard-boiled eggs to a salad. But that's what I've been doing for the last few years. And so let me give you an idea on case studies, because you guys know that I'm always preaching about documentation will always overrule conversation. So let me give you a couple of scientific case studies that were published in a scientific journal. And let you, that's my phone going off. Let me put it under here. But let me give you a couple of them. So in the Journal of Nutrition, a Mediterranean diet, which is similar to a high-fat, low-carb meals, rich in extra virgin olive oil, is associated with reduced prevalence of a non-alcoholic fatty liver disease in older individuals at high cardiovascular risk. So what they did was they took some overweight participants that were at a higher age who already had fatty liver disease and were at high risk for heart disease, and they did research on them with olive oil, and come to find out in the conclusion of this research, their fatty liver started to get less and less and less. Another research was done in the National Library of Medicine. It was published, was called "The Liver Protection Effects of Extra Virgin Olive Oil. Interaction between its chemical composition and the cell signaling pathways involved in protection." So in other words, olive oil has certain ingredients in it that affects the cell signaling and actually helps to reverse fatty liver disease, which means if you're going to reverse fatty liver disease, as you reverse it, then obviously the byproduct's always going to be you're going to lose weight and you're going to reverse your type 2 diabetes if you have it. Now let's talk about molecular hydrogen H2 that's in hydrogen-rich water. How does that help reverse fatty liver disease, obesity, type 2 diabetes, and a lot of other things? Well, because the molecular hydrogen H2 is a very, very powerful antioxidant, and it's a very, very small molecule, so it has the ability to pass the cell membrane barrier, and also has the ability to pass through the brain barrier also. And it also helps to hydrate the blood to help with high blood pressure. But in 2019, there was some research done by a Japanese research team and a United States research team in the National Library of Medicine, is where it was published at. And it was published in 2019, which means we probably didn't get it until 2020. But when they took participants who had fatty liver disease, and they introduced them to molecular hydrogen H2 water, which is in the hydrogen-rich water, and they hydrated them. And they put them at I think it was like it was 110 ounces or 120 ounces of water a day, and then monitored their fatty liver. And just by doing that alone, they didn't do olive oil with it, and they didn't change their diet or nothing, but just by doing that alone, they reversed fatty liver disease. And there was another research done by the World Journal of Gastroenterology. I have a hard time saying these words, they're just my tongue just doesn't do very well. Anyway, in this clinical site, they tested molecular hydrogen H2 with hydrogen-rich water, and the effects of what they called alkaline electrolyzed or hydrogen-rich water in a high-fat diet, and they used it with high-fat diets on people who had non-alcoholic liver disease. They also showed by the combination of the two that the water, the molecular hydrogen H2, actually escalated the effects of the high-fat diet on reversing the type 2 diabetes or the fatty liver disease. And what's the byproduct of reversing the fatty liver disease? I told you. You're going to lose weight, or if you have type 2 diabetes, you're going to reverse it. These are just a couple of scientific case studies I have in my computer. There's a lot more out there that shows this. Every year we're getting more and more out there. And so what's the conclusion to all this? Well, the conclusion is that most of you that are overweight most likely have some type of level of fatty liver disease. And before you can even think about losing any kind of weight, you first of all have got to reverse your fatty liver disease. Now, if you don't want to go and get a ultrasound of your fatty liver, you don't have to. All you got to do is just change your lifestyle. Change what you're eating. Incorporate intermittent fasting. And now, you know what's really, really cool about intermittent fasting, guys? That if you're doing it right, if you're doing a true fast, intermittent fasting or an extended fast, and you're educated about it, and you've got good guidance on how to do it right off the top. Don't make mistakes, because you're going to make a lot of mistakes. So get somebody like me and guide you through the first 90 days. Intermittent fasting, extended fasting, guys, can be used with any diet. So you don't have to be on our high-fat, low-carb diet. You could be on any diet out there. Research has already shown that. As a matter of fact, research has shown that when you do alternate day fastings, which most people can do, it's very simple for them, that they have research showing that on your non-fasting days, when you don't fast, you can eat anything you want. I don't care what it is. Anything you want. That's what they did. They did a research to see if people would lose or reverse certain diseases and lose weight by doing alternate day fastings. And and they did a research on it and found out that people who they ate whatever they want on their non-fasting days. And then on the fasting days, they did either an 18-hour fast or a 20-hour fast or a 24-hour fast. And then the next day, they ate whatever they wanted at any time. But what happened over time was they didn't want to eat all that processed bad food all the time, because as their bodies were getting cleansed from the fasting, the body was realizing that all that processed, crappy, sweet, high-carb processed foods, you're not going to feel good. So the body's going to automatically make you start eating better on your non-fasting days. But it will take you longer to reverse fatty liver or to reverse type 2 diabetes. And that's why we recommend you should be doing a high-fat, low-carb meal and incorporate intermittent fasting or extended fasting along with the water, hydrogen-rich water, while you're trying to reverse your obesity or your fatty liver or your type 2 diabetes, because you want to get away from that disease as quickly as possible, so you're not going to have any side effects. And you want to get away, if you're on medication for type 2 diabetes, you need to get off that medication as soon as possible, because the long term on the medications, that causes side effects also. Okay, so guys, you can go to my YouTube channel, type in Bill Mabry, subscribe to it. There's some videos on there, or you can go to my Fat Loss Made Easy Facebook group page. I got lots of good training videos there, and I also got some of my favorite fat burning recipes in the downloads, and there's also a couple of free books in there for you also, so go check that out. And also, if you want to know more about our online personal coaching to reverse fatty liver disease, to reverse type 2 diabetes, and to help reverse obesity, and or get burn off that belly fat, contact me at bill@billmabrycoaching.com, and I'll send you the information on our different courses that we offer. Okay? See you guys at the next video. Bye.